Thank you for joining us for this consumer update to discuss the nation's healthcare reform law. I'm Sandy Prager, Kansas Insurance Commissioner and Chair of the National Association of Insurance Commissioners Health Insurance and Managed Care Committee.
And I'm Monica Lynn Dean, Montana Insurance Commissioner and Vice Chair of the NAIC Health Committee. As you know, the Patient Protection and Affordable Care Act, also known as Affordable Care Act, became law last year. And even though it's been a hot topic in the news, we know consumers still have many questions.
So we'd like to share some of what we know about how this law may impact your insurance coverage, starting at the beginning. You may wonder when the healthcare reform law will take effect.
The Affordable Care Act is scheduled to be phased in during the next few years. Most provisions will not take effect until January 1st of 2014. However, some new protections were implemented when plans were renewed after September 23rd of 2010.
For example, new federal high-risk pool programs and transparency measures were adopted last summer. You can see charts of when certain provisions become effective at NAIC.org or go to the U.S. Department of Health and Human Services website. Some consumers have questioned whether they will be required to give up the coverage they currently have.
The plain and simple answer is no. Health plans that were in effect as of March 23rd of 2010 are grandfathered under the law and are considered qualified coverage. That means they meet the mandate to have health insurance in January of 2014. Some consumers are also asking why the law will require them to purchase health insurance coverage.
The key goal of the healthcare reform law is to ensure that nobody can be denied coverage or be priced out of the coverage due to a health problem. If you allow people to wait until they have a health problem to purchase insurance, the health insurance market just won't work. There will be a small number of very expensive choices for everyone. So, the law requires that everyone have minimum coverage, creating a larger pool of both sick and healthy individuals.
You've probably heard about something called health insurance exchanges. These exchanges are the central mechanisms created by the health reform law to help individuals and small businesses purchase health insurance coverage. Some states, like Massachusetts and Utah, have already set up exchanges. Beginning in 2014, an exchange will be available in every state to help consumers make valid comparisons between plans that are certified to have met benchmarks for quality and affordability. The exchanges will also administer the new health insurance subsidies and facilitate enrollment in private health insurance, Medicaid, and the Children's Health Insurance Program, also known as CHIP.
The federal law will not require anyone to purchase health insurance through the exchange, although subsidies will only be available for plans sold through the exchange. The law's intent is to make purchasing insurance through the exchange easy to do in a matter of minutes. Currently, individuals with pre-existing conditions have difficulty obtaining adequate health insurance.
This is where the high-risk pools Sandy mentioned before come into play. Roughly half the states will have their own pools, while the rest opted to have the federal government operate their pools. In every state, coverage is available through high-risk pools to individuals with pre-existing conditions who have been uninsured for at least 6 months.
These programs provide immediate coverage for pre-existing conditions at premiums that are capped at the average cost of private coverage in your state's individual market. We'll also be seeing some changes that improve consumers' access to preventive care.
In fact, health insurance plans that became effective after March 23, 2010 must now cover certain preventive services and eliminate any cost sharing for these services. If you have a health savings account, or HSA, you'll still be able to contribute if you choose to do so. The minimum level of coverage required to meet the individual mandate was specifically designed to allow for the purchase of a qualified high-deductible plan that would complement the HSA.
We have all seen health insurance premiums rise during the last decade, and unfortunately, the grim fact is that healthcare spending is likely to continue rising faster than the general rate of inflation well into the future, resulting in higher premiums. While some individuals and families with health problems may see their premiums decrease significantly under the new rating rules, for most Americans, premiums will continue to increase year to year. However, the new regulations are designed to prevent unreasonable and unexpected spikes in premiums and, over time, to slow the overall growth in healthcare spending.
The new law means there will be some changes for employers too. There are some new tax credits for small business owners who provide coverage, and not all businesses will be required to provide that coverage. The employer responsibilities under the health reform law do not apply to employers with 50 employees or fewer. However, they will be able to enroll their employees in coverage through the exchanges beginning in 2014.
Employers with more than 50 employees will be required to provide insurance, and an employer that fails to offer minimum essential coverage will be subject to a penalty. If you're self-employed, you will also see changes in your health insurance choices. Beginning in January of 2014, self-employed individuals and their families must be included in the small group market in all states and will have the option of purchasing coverage through the exchange. This will increase plan choices and include the self-employed in a more stable pool.
And no employer will be required to drop current coverage. Group health plans that were in effect as of March 23, 2010 are grandfathered under the law and will be considered qualified coverage that meets the mandate to have health insurance that begins January 2014. Employees and dependents can be added to the policy without losing their grandfather status. In addition, employers may change health insurance carriers without losing grandfathered status as long as the plans are substantially similar.
Employers will also be allowed to continue to provide assistance to their employees through flexible spending accounts. Nothing in the new law eliminates or discourages these kinds of programs. Finally, let's talk a little about some of the issues that are of particular concern to senior citizens.
While many folks worry their benefits will be cut under health reform, the new law does not eliminate or reduce any benefits provided under Medicare. More than 3 million seniors currently have found themselves in a prescription drug coverage gap, with costs that push them into what's called the donut hole. In fact, seniors who reached the donut hole gap started getting a $250 rebate last year, and beginning this year they'll get a 50% discount on prescription drugs, and the gap will be phased out until it is completely eliminated in 2020.
Many seniors have what's known as a Medicare supplemental plan or a Medigap plan. The new health law does not require seniors to change any of their Medigap coverage. However, the law will be adding cost-sharing requirements to plans C and F that are sold after January 2015. These are some of the highlights of the new law and just a sample of the questions we've gotten about the changes to come. It's important that every individual understand their choices when it comes to appropriate health care coverage for their family. Your state insurance department is a great place to turn when you have questions about your coverage options.
If you still have questions, please call your state insurance department for free, unbiased assistance. You can also get more information at NAIC.org.
And thanks for joining us.